Thank you for being here. I'm Dr. Angela Sullivan. I'm an assistant professor in the Department of Health Behavior. I'm assistant dean in the Office of Student and Academic Services. And I was actually sharing with our speaker here, Dr. Dobbs. I've also been a preceptor for our MPH students. I also am president of a community organization that does a lot of work with the School of Public Health, and I'm also a very proud alum. I got my PhD from the School of Public Health, and so first, to speak to the loved ones, I would like to say that your family, your friends are in a place where they'll be taken care of. I have been taken care of, and I'm very happy, very proud to be speaking to you today. Not just as the admissions dean, but also, like I said, as a proud alum of the school. And so I'd actually like to do something a little bit differently. I realize we're about halfway through the semester, but I would like to share a couple of things that I found interesting about our incoming class. I also want to acknowledge, we've got online programs, fully online programs, which means there's people not here in Birmingham, and they've joined us via Zoom online. So thank you to those who are joining us via Zoom today. So a little bit about our incoming class. They actually represent 16 countries, including the U.S. Those from the U.S. actually come from 21 different states in the District of Columbia, so we're well represented. Our incoming class speaks 20 different languages at the native level, many, many more at intermediate or advanced stages, and that includes American Sign Language. And I share these facts with you all about where we're coming from, or where you all are coming from, to indicate maybe where we're going. So what we can work on collaboratively as a School of Public Health, but also the reach that this class comes with. And so that also is in the case of your educational backgrounds. Most students actually are coming directly from another full-time degree. So maybe in May you wrapped up a bachelor's degree or another master's degree, and you're coming here for your graduate studies or another master's program. But you all, about half of our incoming class has worked full-time, many in healthcare, many in public health already, so you bring that experience here. Also business and higher education, as well as many, many other professions. So welcome to UAB, welcome to the School of Public Health, but also welcome to the profession of public health as well. So thank you for being here. I can't wait to get to know you all. And next, I have the honor of introducing you to the Associate Dean for Academic Affairs, Dr. Greg Pavella.
Thank you, Dr. Sullivan. Welcome, everybody, this afternoon. And I'd also like to extend a warm welcome to those that are joining us virtually today. We're excited to be able to have you participate in this event with us. So my name is Greg Pavella. I'm the Associate Dean for Academic Affairs in the School of Public Health, and I'm an Associate Professor in the Department of Health Behavior. And today I really just have the privilege of being able to introduce you to some of the academic leaders in our school. And I want to start by introducing you to our Senior Associate Dean, chairs, and then some of the expertise in our faculty in the school. So Dr. Lisa McCormick serves as the Senior Associate Dean for Academics and Practice and leads the Office of Public Health Practice. Dr. Suzanne Judd is Chair of the Department of Health Behavior. Dr. Martha Wingate is Chair of the Department of Health Policy and Organization. Dr. Beth Lewis chairs the Department of Epidemiology. Dr. Jeff Schakowsky chairs the Department of Biostatistics, and then Dr. Jeff Wycliffe chairs the Department of Environmental Health. And we're also joined today by some of our faculty members who bring to the classroom their research and their mentorship, the full range of public health knowledge and expertise ranging from nutrition, cancer control, water quality sampling, advanced statistical methods, cohort studies, cost-benefit analyses. I know that you're becoming more familiar with your studies and your degree programs, but there really is a breadth of content in the School of Public Health that you can be proud of. The school and its academic departments offer a total of 28 degrees and certificates at both the undergraduate and graduate level, and I recognize some of you here from my undergraduate course. The school also coordinates with 14 other schools in the university or outside of UAB to offer a coordinated MPH degree with many other degrees, including medicine, law, and business. Our most recently approved degree concentration is a timely one given current events, and that is the DRPH in Preparedness Leadership, with Dr. McCormick as its inaugural program director. This program is going to begin admitting students next fall, and it will prepare students to lead organizations and work with communities before, during, and after large public health emergencies. And that's really been at the forefront of my mind recently with the hurricane that delayed the first version of this event, the hurricane that occurred in the middle, and now we have a hurricane, a very large one, set to hit Florida tomorrow. So that seems like a very timely discipline to develop in the School of Public Health, and seems related to the new graduate certificate in climate change and health, in environmental health as well. Finally, I do want to recognize and thank folks in the Office of Student and Academic Services who helped organize this event, along with volunteers from other offices and departments. Thank you all. And I'd especially like to thank Amanda, in particular, the Director of Admissions in the School of Public Health, lead organizer for this event, and she's organized it for the very first time, and you're making it look very easy. So thank you all. Welcome to the School of Public Health. And next, I have the honor of inviting Dean Irwin to the podium.
Thank you, Dr. Pavella. And again, my thanks also again to all the staff who have made this event happen. So good afternoon to all of you, students, family. I'm Paul Irwin, and I serve as your Dean of the School of Public Health. It's my pleasure to welcome you to the School of Public Health and to our special orientation event for the public's health. This event grew out of our discussions with several students and alums about developing an event for all incoming students to introduce you to the school and to your classmates, and as a way to create a sense of community. A ceremony like this is unique among schools and programs of public health. Our School of Public Health event was also inspired by the white coat ceremonies held in medical schools across the country for incoming medical students. We want our public health induction ceremony to be clearly tied to the values to which we all aspire as public health professionals, whether in academia, practice, or other setting. Those values and the internal ethic of public health set us apart from medical schools and other health professions. We're elated to bring this event each year from Vulcan. Now, when I was a medical student here a lifetime ago, Vulcan's torch, which is now a spear, was a light, and it usually shone green unless there was a traffic fatality that day in Birmingham, in which case it was red. That had a way of connecting residents across the city. We each bore some part of someone's loss. The connection today for me is the promise and hope of a Magic City icon that serves as a welcoming beacon for all. We are all forged in ways that are both common and unique, but we comprise one community of public health. And tonight we celebrate this community in welcoming our newest members, our new students. For the Public's Health is our opportunity to introduce you to public health as a community of scholars and professionals dedicated to improving the health and well-being of everyone through research, education, and service. As a class, you are about to embark on a journey unlike any educational experience on the campus. Your classmates are the most diverse at UAB. You will have the opportunity to learn from each other as you explore the complexities of healthy people, from their genetics to their neighborhoods. Your classroom will become a shared experience with fellow students who come from a broad range of social and cultural backgrounds that will enrich, inform, and guide your studies. You will have the opportunity to grapple with the most complex problems facing our communities, from those we live in to those across the planet. It is now my honor to introduce our speaker this afternoon, Dr. Thomas Dobbs. Thomas Dobbs is the Dean of the John D. Bauer School of Population Health and Professor in the Division of Infectious Disease at the University of Mississippi Medical Center. He received his medical degree in 1996 and Master's in Public Health in 2000 from the University of Alabama at Birmingham. Dr. Dobbs is an active clinician and researcher working in the fields of HIV, sexually transmitted infections, and tuberculosis, with a focus on the intersection of disease and the social determinants of health. Dr. Dobbs actively serves as a state and regional TB medical consultant with the Mississippi State Department of Health. He is a clinical consultant for the Southeastern National TB Center, supporting medical consultations and TB educational efforts for the region. Prior to his work with the Mississippi State Department of Health, Dr. Dobbs worked for many years with the Alabama State Department of Health TB program and the Georgia TB initiative at UAB, supporting programs domestically as well as in Russia and Cambodia. He has a long career working at the crossroads of clinical medicine and public health. He has held numerous leadership roles with the Mississippi State Department of Health, including state epidemiologist and state health officer. During his tenure as state health officer, he directed the state's response to the COVID pandemic. As part of the pandemic response, Dr. Dobbs focused the agency on addressing the numerous health inequities that plague the state, adopting several innovative approaches such as elevating health equity to a leadership role in the incident command structure, developing an extensive faith-based partnership, and creating on-demand vaccine clinics for communities alienated from existing healthcare systems. Dr. Dobbs is a public health physician who approaches public health challenges from a population perspective while preserving awareness of the needs of individual community members. Dr. Dobbs, we are so proud of everything you have accomplished. You are a model graduate, and we are so glad that you have taken time out of your busy schedule to share some words and wisdom with us today. Please welcome Dr. Thomas Dobbs.
It's good to be back in Birmingham. Actually, I didn't know they had changed the lights on the Vulcan. You know, that was all the way it was when I was growing up here. Actually, I lived here a little bit as a kid, and then I went to med school here, and as you could hear, I've been here for a while. So I'm going to go over a few themes with you guys, but they're all going to relate to one common point, is that you have made a fantastic decision to engage in a public health career. One of my friends and colleagues, who used to be the health officer in Arkansas, when he would work with the medical students in the University of Arkansas, he had something he would tell them when they were trying to figure out what they wanted to do, and this really stuck with me as really a fantastic bit of advice to share with developing professionals. And his advice was to choose a career path that aligns with your values, right? It's real easy to choose a career path for the wrong reasons, but if you align yourselves with your values, then you're going to be able to have a career that you can do with energy, with love, with joy throughout your working time. And with that being said, I can attest to that because, you know, I graduated a long time ago. And it's still a lot of fun. I really enjoy my career, and I can't say that how important his advice was. And I would observe that people choose a public health career because of their values. That's the reason people do public health. There are a lot of reasons why it's important to get involved in this career field, and one of them has to do with the past. If we consider where we are in our health journey as a country, if we look at the advances that we've made over the past century and a half, past century or so, if we look at the gains in life expectancy that have been achieved, most of the improvements we saw actually were in the first half of the 20th century. In the early part of the 20th century, infant mortality was extremely high. People died at young ages from infectious diseases. People died from contaminated milk, right? From brucellosis or TB infection of the food supply. And over time, through public health measures, we had a marked improvement in our well-being, our prosperity, our longevity. that had nothing to do with clinical health care, but everything to do with public health. The past should lead us forward. If we consider where we are now in our health journey as a society, we see that we are overly invested in clinical endeavors. Now, I'm not saying they're not important. I think technology is fantastic, and I'm very happy we have CAR T therapy. I'm glad that we can do transplants, but we cannot depend on technology to get us out of the rut we're in when it comes to our life expectancy, when it comes to our maternal mortality, when it comes to our infant mortality. Our technology is not going to save us. We have to look back at the lessons learned from public health. There is, as an example, there's a horrible thing going on right now, and we're seeing it really severely in Mississippi, and y'all have it too, I know. Y'all are seeing an explosion of syphilis, right? Y'all are seeing an explosion of syphilis, and there are babies dying on a regular basis who are born with syphilis. How horrible is that, right? Do we have the technology to detect and treat syphilis? Why do we have syphilis? When you look back at the system that we have, the health system that we have, it has nothing to do with technology, it has nothing to do with the knowledge, it has to do with the system that we have created that allows for us to have a society that lets babies be born with syphilis. Now, there's a quote that I love, and I'm going to misquote it, or a little bit misalign it, is every system that we have is perfectly aligned to give us the results we're seeing today. So the reason we have a bunch of syphilis is because the system is designed that way. And when we've done our own investigations, and I think some of the same things are going to apply to y'all's situation, we see that women don't have access to prenatal care. We see that there's barriers with being seen. We see that there's barriers within bias in physicians to even test and find it. We see there are system barriers where people do not have access to treatment because of bicillin, which costs 10 cents to make a dose. The company charges $1,500, right? And so people can't access it. This is the system. And we have a public health system that has been undermined such that we don't have the disease investigators that we had previously where we can intervene in outbreaks. We've forgotten the important lessons of the past. We need to think about it from a system-based perspective. So that's the bad part, right? We know that public health works. We know that it saves lives. We know that as a country we've lost our way a little bit. We're underinvesting in public health. But where there's a challenge, there's also an opportunity. My personal opinion is that public health is an inflection point. I think we're at a point where we're going to see major shifts in how we approach our public health interventions. And part of that's going to be because, yes, the old model worked fine, right? But we're not in a brick and mortar world anymore, right? It's time for public health to kind of move into the future. Use these tools, use these system-based perspectives where we can use the new technology to bring in a new era of health. If we look at where public health has been most successful over the past century, it's been with infectious diseases issues, right? We eliminated smallpox. There is no smallpox anymore. Measles is mostly eliminated, although with some other issues we're having a threat of resurgence. But if we look at what's really killing people today, what's killing folks? How are people dying? It's chronic disease, right? We're having, heart attacks is the number one. We're seeing cancers at an alarming rate. We're seeing a lot of metabolic-related illness because of our diets and lifestyles. Firearm mortality is the number one cause of child death in our country. It's alarming, isn't it? So we have these other challenges that we need to turn our lens upon so that we can use those tools that you're developing to make sure that the next generations have greater access to health and prosperity. You are engaging in the most important work that there is. All right, so two of the reasons why it's really important that your job is going to be so great is because we know how important it is. We know there's a phenomenal challenge, right? Values. The other thing that makes it so great is you're going to work with the most wonderful people, right? So we've already established that people go into public health because of their values. And if your value is to help other people to see a better future, a better health landscape for the people in your community or people who are not in your communities, those are wonderful people to work with, right? And so in your career, you're going to encounter so many neat people and encourage you to embrace that with your whole heart. As I think back on my career, which when I was coming up here, I was kind of thinking about what I was going to talk about, and it made me feel really old for all the neat little things. But I've met so many neat people and had so many interesting experiences, and I was kind of reflecting on some of the more nuanced ones, right? We're talking about, you know, when I was at UAB, some of the coolest stuff that I was able to do were through my relationships that we did some international travel, and I was thinking about how some years ago I was drinking vodka with the Russian military on the banks of the Tomsk River. Now, that probably wouldn't work out so well right now, but what a great memory, right? And what being able to work with people across cultures, across different even sort of political divides. And then also thought about my work, and one night I won an arm wrestling contest in Phnom Penh. I really did. Now, I'm not saying the competition was stiff, but I still won. Those are the kind of experiences and the kind of people that you meet. You can have really neat opportunities. But then when I think about the day-to-day, I think about how much I value the partnerships, the friendships, the collaborations that I've established in my day-to-day work trying to fight HIV and LGBTQ-related stigma in Mississippi. And what kind of difference that makes on a day-to-day basis. So I want to thank the School of Public Health here at UAB for helping me translate my values into a career. As a physician, as an MD, I don't think I would have had near the opportunity if I hadn't had that key, if I hadn't had that wedge that showed me how to translate that into a public health career where I could see some interesting things, hopefully do some worthwhile work, but also too, even as older in my career, I'm just excited as I was 25 years ago, and hopefully that's not going to peter anytime soon. So congratulations on a fantastic career choice and a career path, and I really appreciate you, Dr. Irwin, for inviting me, and look forward to chatting with you all after we're done. Thank you. And so now we're going to read the pledge. We, say along with me, we, the incoming students of the UAB School of Public Health, holding sacred our duty to safeguard the health of our community, affirm our beliefs as we embark together on this important journey in our training. We will dedicate our time and talents to the preservation of public wellness through scholarship, education, and service. By declaring our beliefs, we affirm our commitment as students, as advocates, and as citizens to work in partnership with the women, men, and children of our community in order to protect the common health, the common rights, and the common good. We believe that every member of our community is valuable. We believe that every member of our community should have access to health care, health education, and preventive services. We believe that, as students of public health, we bear a duty to protect our community from suffering, and therefore, today, we begin the training necessary to provide that protection. We believe that our efforts can only succeed if they are undertaken in partnership with those whom we endeavor to serve. We believe in innovation and embracing change. We believe in forging alliances and consensus. We believe that the scope of our efforts cannot be restricted by time or geography. And we believe that the obligations to which we pledge ourselves today will endure long after we have finished our training. It is upon these beliefs that we undertake our education, understanding that we work not only to better ourselves, but for the betterment of the communities we serve. We are All right, well done. Congratulations.
Hello, I'm Sarah Hendren, the Alumni Affairs Specialist for the School of Public Health. I know some familiar faces here, and I hope that through your journey, if there are ways that I can help you, and certainly at the time that you graduate, that you'll come and find me as well. But for this evening, first off, I want to say again, thank you so much, Dr. Dobbs, for your comments. We are very proud to call you one of our alumni, if we can take that claim. For all of our students participating both in person and online, we thank you for being here and joining us virtually.